Hi everyone, my name is Aisling and I'm one of the physios with Spectrum Health. I work in Sandyford at the moment. So today I'm here to talk a bit about what can happen after COVID, even a mild case, and what we are going to do to help to manage that. So you may have heard of people having problems months after having a case of COVID. And this is what we are now calling long COVID syndrome. So what that essentially means is just that you're having COVID symptoms for a long time and we're not exactly sure the pathophysiology behind it yet, so we're just calling it syndrome to kind of group it in as one thing for the moment until more research is done. Now, long COVID syndrome seems to affect lots of different people from any age, background, ethnicity, gender. It doesn't really discriminate. So what we are trying to do as therapists to help manage this is to set up services that will, educate people and help them to understand more about how to best manage their symptoms so they don't constantly get flare-ups of fatigue or tiredness or pain. So we're using a lot of the research that's come out of the UK to help with the setup of these services, and hopefully this will be something that will help to guide you in your management and rehab with long COVID. One important thing to note is that there hasn't been any research done in regards to if exercise is safe with people with long COVID. So what that means is we know if exercise is feeling okay for you and it's going well for you, that's fine. For some people, it may just make their tiredness worse. So we need to keep an eye on that, and that's where the management strategies come in. The other thing to think about is we also need to rule out other causes of symptoms after COVID. So if you are having any odd or unusual symptoms, it's to make sure that you link in with the GP or with the, if you're under an infectious disease consultant, to link in with them and make sure that other causes of your symptoms are ruled out before we start calling it long COVID. So we will be setting up a service that is going to involve remote sessions involving education, guidance and management of these symptoms. So if you feel like this is something that you would like to avail of, you will be able to avail of it through your insurance provider or through self-pay options.